Ophthalmia neonatorum is the most common eye disease of newborn. It is a type of conjunctivitis which occurs in infants younger than 4 weeks of age. With these words, I am Dr. Manish and I welcome you all to another interesting clinical video on Ophthalmia Neonatorum. So let's start. Four-day-old male baby weighing 2.8 kilos presented with complaint of discharge from eyes since morning. Full term appropriate for gestational age baby delivered at home. 28-year-old mother didn't take antenatal care. On examination, purulent discharge is coming from right eye, resulting in sticky eye. Both upper and lower eyelids are swollen. Purulent discharge is also coming from left eye. If you observe carefully, you will note congested bulbar conjunctiva. Marked bruising and somewhat suffusion of the face is present as a result of face presentation. This type of face is considered the equivalent of caput with the face as the presenting part. Based on presenting complaint and examination findings, a diagnosis of Ophthalmia neonatorum is made. Now let's have a look at causes of Ophthalmia neonatorum. It is caused by silver nitrate eye drops, Neisseria gonorrhoeae, Chlamydia trachomatis, Staphylococcus aureus, and Pseudomonas aeruginosa. The next step in evaluating these babies is establishing etiological diagnosis for definitive management. Whenever you examine a newborn with ophthalmia, the first question to come in mind should be, when did conjunctivitis appear? The cutoff time frame is 48 hours. If the answer is less than 48 hours, think of silver nitrate eye drops as the possible cause, which is instilled as part of topical ophthalmic prophylaxis at birth. But in our baby, it was not instilled. Our baby developed conjunctivitis on day 4 of life. Any conjunctivitis appearing after 48 hours should be evaluated for a possible infectious cause by sending gram and Giemsa stain, and based on findings of staining, appropriate cultures should be sent. The result of gram stain in our baby showed intracellular gram-negative diplococci, so a diagnosis of gonococcal ophthalmia is made and appropriate culture sent. Finally, coming to treatment, which consists of giving injection ceftriaxone in a dose of 50 mg per kg for one dose, not to exceed 125 mg. The eye should be irrigated with saline every 10 to 30 minutes, gradually increasing to 2-hour intervals until purulent discharge has cleared. Treatment should be extended if sepsis or other extraocular sites are involved, which in our case is not there. See how inquisitive the child is, ready to see world with new eyes. That's all for now in this video. If you have any queries or suggestions, then do post in the comment section below. If you haven't liked or shared yet, then do like and share this video, and don't forget to subscribe. Thank you.